Most of the country saw a relatively calm night on what was dubbed Super Saturday. A small number of pubs and bars did have to close their doors early due to some revellers flouting the rules, and there were some arrests made. But health leaders have warned they won't hesitate to enforce Leicester-style local lockdowns if more coronavirus hotspots emerge. Well, Dr. Bharat Pankhania says data on wherever there are new confirmed coronavirus infections is key.
Either we'll have to have lockdowns, which I hope we won't, or we need to up our game. And with respect to upping our game is I, as a specialist in communicable disease control, am very disappointed that in Leicester, they found out that they had a problem after a many days delay. This should not happen. The people in the local city ought to have their data at the same time as the government. This is a failure of not collecting the data properly. What I mean by that is items such as who are you, where do you live, and simple things like your postcode. Goodness me, they were not collecting the postcode. So therefore, the mapping of where these hotspots are in a given area was not possible.
And do you think these are genuine second spikes, although localized, or is it just the result of an increase in testing?
No, these are genuine increase in number of cases. So I wouldn't like to refer to it as a second spike. I would like to, in fact, say it is a continuation of the first spike or the pandemic. It's just that it went down because we were in lockdown measures, albeit in partial lockdown, because it was never strictly enforced. And therefore, with increasing movement of people and the background of the virus in continuous circulation in the community, we get more cases as soon as we change our behaviors. So this is what has happened.
Now, you've kind of touched on data, but we've heard that some local officials are accusing central government of not giving them enough information. So whose responsibility is it? And really, how granular does the detail need to be?
We need information from several sources. Therefore, to just rely on test data is missing a trick. We should also look and analyze and act on data from NHS 111, the general practitioner consultations data, hospital admissions data, hospital A&E data, and any other sources of readily available good quality data we should be analyzing and looking at simultaneously. This data allows us to pick up things going wrong at an earlier stage. Furthermore, the way the system has been set up is that the data first goes to the central headquarters in government, and they do whatever they want to do, which is basically sanitize it. And then they give it, this is pillar 2 data, then they pass it on to the local authority. We're making mistakes. We should never set up systems like this, whereby one person centrally is controlling it in such a manner that it builds in a built-in delay with regards to transmission of data to the people at the coalface who are supposed to be acting on it, and every day's delay equals more cases generated.
So really time is of the essence with this. We've seen an easing of the lockdown over the weekend. People are out and about enjoying some sense of normality. But whose responsibility is it then if the R rate does start to creep up again?
It is everybody's responsibility, but the responsibility lies very much with the national and local leaders. So national leaders have it as their remit to give precise, unambiguous, clear, strict messages with reinforcements. And locally, those messages need to be the same message, repeated and repeated again. So the communication is very important, and we've had a lot of mixed messages. The chief medical officer says what he can say, and he said it very clearly. Be careful, the virus has not gone on holiday. You need to maintain infection control measures. Our Prime Minister Johnson, on the other hand, was quite loose about it and saying, you know, it is open day on July the 4th. It shouldn't be like that, because the mixed messages allow people to think it's all over, let's go out and celebrate. That would undo the pain, the cost, the expenses of the lockdown that we've had in the last few months.
Well, a spokesperson for the Department of Health said, "We have been working closely with our local partners, providing them with the resources and tools so that they can take swift action to deal with any new local spikes in infection."